Okay, I'm going to let everybody in.
All right.
Good afternoon, everybody. Welcome. As you're logging on and joining us, just make sure that you are muted. We're going to wait a few minutes as folks are joining us. Seeing some familiar faces. Hi, everyone. Great to see you, at least even if it's just virtually. For those of you that I don't know, my name's Isis Alvarez. I'm a program director at the Nonprofit Center of Northeast Florida. Thank you so much for joining us today. Again, just a quick reminder for folks that are joining us to mute yourself. If you're comfortable with doing so, go ahead and turn on your camera. We've noticed that it helps folks feel a little bit more present, even if it's just virtually present and a part of the class. Hey, Deirdre. We are recording today's session, just like to give that little warning at the top. We will be sharing all of the materials that we go over today. So the presentation, any resources that are pointed out, whether it's by Drew or anybody else in the class in the chat, we're going to share that out. And we're also going to be sharing out a recording of the session. If you haven't yet, go ahead and introduce yourself in the chat. If you don't know where the chat button is, it's going to be at the bottom kind of ribbon of your Zoom screen. It's just going to say chat. Go ahead and introduce yourself, your name, your organization, and if you can, just kind of what brought you here today. I'm sure everyone has a million reasons, so just whatever comes to mind. For anyone that's just joining us by phone, if you have any questions, please feel free to email me separately. And I can get you any of the materials that you need afterwards. I did send out a sheet this morning for everybody for today's session. If you didn't get it, I'm going to be putting it into the chat in a couple of seconds, so you can access it that way also. With that being said, just to make sure I didn't miss anything. And just a quick note, if you're asking a question through the chat and we don't get to it, don't worry, I'm going to be saving the chat and we can reach out to folks one-on-one. You can see Drew's information on the screen. So if you don't get to ask Drew anything here, I know it's hard to get kind of one-on-one questions, you can definitely, and I don't want to speak for you, Drew, but reach out to Drew directly with that.
Oh, absolutely. Yeah, not a problem.
Awesome. Okay, great. With that being said, I know we have a packed hour, so I'm going to go ahead and pass it off to Drew to introduce himself and kick us off.
Awesome. Thank you so much, Isis. I appreciate that. And I'm so glad all of you are here today. This has been something that has been weighing on me quite a bit because I think it's something that is really at the core of what people keep talking about with this nonprofit pivot, with how we're going to respond to the COVID-19, how many nonprofits are already doing that. So this is really important to me. Again, my name is Drew Reynolds. I'm a consultant at Common Good Data. It's my consulting practice. I work with one other consultant, and we do work to support nonprofits around data evaluation, all kinds of things, programs. So I've been doing this for a number of years, and I'm based in Atlanta, Georgia. I'm also a program director myself, and I work at a nonprofit called Child Spring International. We provide surgeries for kids around the world. So I come to this from a perspective of knowing what it's like to be a program director and trying to think about programs and measuring that impact and communicating that story with the world while also being able to operate and do the good work. So real quick before we get started, I also want to mention another resource that I've just started called the Common Good Hour. It's a new podcast. You can get it on Spotify or Apple Podcasts. I think that what we're going to be doing with this podcast is interviewing every week or two some nonprofit leaders who are going to be sharing their insight, most of it right now focusing on how different nonprofits are responding to COVID-19, but really focusing on the program side of nonprofits rather than sort of the development and fundraising side. So it's really geared towards people who are in those programs positions. And so definitely check it out. You can just search the Common Good Hour and you should be able to find it somewhere, or go to commongooddata.com/podcasts. Also, I started out, today you may have received an email from ISIS that has this primer, the nonprofit program Redesign primer, which we're going to be using as the sort of basis for our conversation today. If you don't have it, I think it's in the chat that ISIS just put in there. You can click that link, or here's the URL to check it out. And So I would recommend having that, open on your computer somewhere, or you can, if you have a printer next to you, you can print it off real quick to follow along as well. In particular, is the sections 9 and 10 of it, where there's some parts where you can kind of fill in as we go along, and that can be kind of helpful. But even if you don't have a chance to do that, just following along and knowing that resource is there, you can use that afterwards to check it out. So, but highly recommend it. All right. Oh yeah, I already said pages 9 and 10, and all right, I'll go ahead and get started. I guess I gave a little bit of introduction about me already, so you know who I am, that I'm a consultant, and I also serve as a program director. And so you also feel free to reach out to me with questions, both in the chat right now or just afterwards. You'll have my email at the very last slide, and I'm happy to meet with any of you and talk through things or whatever, anything I can do to help you out, because I know that there's just so much that you're probably thinking through right now and trying to evolve and adapt during this crazy time. So asking question times in the chat. So I want to start off with just a broad question here. So now what do you do, right? We're in this moment, and I was sitting in my my house about 3 or 4 weeks ago when I started putting this together, and it's like, and I had that same question for myself as a program director, because we do medical surgeries, and part of one of the key parts of our programs is that we bring children to the United States for surgeries. Okay, you can't do that right now, right? You can't have children crossing borders. You can't have medically fragile children on planes. I mean, there's all kinds of logistical challenges. So I'm asking that question to myself: what do I do now? I'm working from home. I'm not with my colleagues. I don't have that in-person kind of chance to share ideas. And so now that I'm stuck here, what is my next step? What should I be working on, and what should I be doing? I think that, when I was looking through the chat here and I saw people who are doing after-school programs or working with youth, some people who work with schools or who provide direct services that are just stopped right now. You might be asking that question of yourself, being like, normally right now I would be, helping kids through graduation. Normally right now I would be hosting a really big event, and we're not doing that. And so you might feel like you're sitting on idle hands sometimes. And so I wanted to talk a little bit about program redesign as an opportunity for all of us to just take that big step back and to start thinking about the questions, the problems, the difficulties and challenges you always knew were there, but you just never really had a chance to get to them. Maybe you're a program director and you're like, man, I run this thing and I know how this program works, but we really haven't written any of it down. We don't have a manual. If I left the program tomorrow, the next person would not know what to do. So maybe that's a part of it you're working on. Or maybe you're asking yourself, like, we really have struggled to measure impact in some capacity. I really want to start focusing on that. Or maybe you're like, we really wanted to make an impact on X or Y or Z thing in our particular cause area, and we just really didn't get it. We didn't get it to where we wanted it to be last year. And so then you're going to say, okay, I'm going to focus on how I can really rethink that piece. And so that's really what I am hoping that some of this social distancing time can be for nonprofits. It's not perfect. Nobody would have chosen it. But now that we have it, maybe we take this opportunity to kind of step back and think about some of those deep questions. So I want to start off first by asking a question: how has COVID-19 affected your programs? And I think actually let's go ahead and do those breakup grids, if that's all right. And I think what we'll do is we'll break out into groups of 4 or so. And I want you just to take about 5 minutes. You can do a quick introduction of yourself, just to say who you are, go around in a circle, introduce yourself, just say your name and your organization. And then then go ahead and also talk about how this has affected your program. So if it stopped your programs, share that. If it has, you've already started modifying, you can talk about that a little bit too. But just to kind of get our ideas flowing and to hear from you. So I'm going to go ahead and send us all out, I think. And Isis, are we good to go?
We are good. Drew, I think you received an invite to join a room. Don't accept it, but everyone else, go ahead and accept that invite that you received to join a room.
All right, and we'll talk in a few minutes.
All right, Drew, I checked on everybody and they seem to be going. So uh,
Awesome.
just let me know whenever you want me to close out the sessions and I can give them a 60-second warning and close it out.
Perfect. Let's give it a couple minutes.
Perfect.
And then actually real quick question, when they come back, can we ask them to share a little bit?
Sure. We can ask them to share into the chat. Might be
Okay.
the easiest, just so folks don't all unmute at the same time. That would probably be the easiest way. So I don't know if you kind of want to vamp or move on a little bit and we can wait for them to come in. Because it might be hard for folks to unmute and share, or maybe not. You can just say, anybody want to unmute and share?
Yeah, what's our total number right now?
We are at, I think, 16.
16?
Yeah.
Maybe we'll try the unmute and share. I
Okay.
don't know. It might not work out, but we'll see. But what I'll do is I'll say, I would love to hear from two people, and then and that way we'll know that it's just those two. And
Perfect.
I think a couple people will come in, and then when I see somebody's face come up, I'll just say, okay, hey,
Yeah.
I saw this name. You go ahead, and we'll
Yeah. Right. We'll probably have a few seconds where they're just kind of like waiting. So
most people are going to be like, I'm not talking. So
right. Yeah, that sounds good though.
Although I guess this is probably all recorded right now. I don't know. Whatever.
I think it is.
No, I know that it's going to be great.
Perfect. All right.
Perfect. I was just going to say, that sounds great.
I'm going to start the 60-second timer now.
Perfect.
All right, welcome back, everybody.
Hi.
Awesome. So as people are coming back, thank you for taking that time to talk through how it's affected your programs. I know if you were at all like me, I probably had 9,000 things I could have said in that conversation. You probably only had a couple of minutes. But the idea, I think, is just to hear from other people and to see kind of that struggle is a shared one, and also that there may also be solutions among this group that could help all of us move forward. So before we kind of dive on past this slide here, I wanted to take maybe two people who could share something that they shared in their small group breakout session with the group. And so, yeah, two people.
And if you'd like to speak, just go ahead and unmute yourself.
I think Victoria from the MD Anderson Cancer Center should talk.
All right, Victoria, where you at?
Thank you, Denise. Hi, everybody. I am the Associate Director of Development at Baptist MD Anderson Cancer Center, and I was just sharing how, obviously, being a healthcare organization, we were affected, revenue-wise by people having to reschedule those elective surgeries and procedures and appointments. And I mentioned how we're kind of shifting our narrative now in like marketing campaign from emergency response into recovery, and really letting the community know it's okay to come back to the hospital. It's safe. It's safer for you to come back here than it is to go to a grocery store. Like, we have all of the proper precautions and procedures in place to ensure your safety and well-being. And we would really hate for a condition to worsen because you're putting off getting the care that you need right now, just out of that like apprehension from being in public and being around others. And we've also had to shift our thinking around a lot of the events that we've had. We have a lot of events, not just at the cancer center, but throughout the whole health system, like the Children's Hospital as well, that have been around for like 20 and 30 years. And we're kind of using COVID as an opportunity to rethink those, because a lot of staff hours and planning go into those events. And we're not seeing, a huge return on investment when you compare it to just individual fundraising. So we're really taking this as an opportunity to think, what events can we, turn virtual? What events can just be, a letter writing campaign for that time of year instead of actually having a gala or a golf tournament or things like that. So we're really shifting into a planning phase right now and thinking through a lot of our longstanding events.
Thank you so much, Victoria. Those are great examples. And I think that speaking to really the need that the world has shifted so much, and that perception is so changed about what is possible, that there's almost like a reconvincing that needs to happen for, I think, many programs that, in your case, that you have opportunities for people to come and to receive an elective surgery safely. But for other people, it might look different about saying, hey, yeah, we are still open. Hey, these are the ways in which we can still connect while maintaining, of course, our health and safety. So thank you, Victoria. Let's take one more.
I guess I could speak up.
Thank you, Denise.
Hi, I'm Denise Reagan. I'm with the Garden Club of Jacksonville. We have kind of two major parts to our organization. One part is we're a rental facility. So as you can imagine, starting March 15th, like every single rental that we had scheduled, and there were a lot of weddings, a lot of fundraising galas. So a lot of other nonprofits have their events here. So all of that was canceled or postponed, or postponed and then canceled. Wow. So yeah, so we've lost thousands of dollars of revenue that the Garden Club, as a nonprofit, counts on to do all of our programming. So we do all sorts of educational programs. We have a couple of major community outreach programs that we do, big events that draw thousands of people. And we had one that was scheduled for the first weekend in April that had to be postponed, and we're hoping to do it in the fall, but we're not certain that that's even a smart thing to do. Now we do have a lot of outdoor space, so we do have the ability to kind of pivot and put a lot more things outside. but we're still not certain what the appetite is for that sort of thing right now, particularly in people don't even know what's going to happen with school. Like, will their child be in school in the fall? What will that look like? What will universities be doing? I think there are many other bigger priorities than the garden club, frankly.
It's so hard, and I feel like so many people have had that feeling in the past couple of weeks or months, of that feeling of the rug just totally pulled out from under you. Like, the thing that is your bread and butter and what you do and what is core to your mission is now no longer possible in the way that it was before. So I think I'm hoping that this session is a chance to start thinking about what types of possibilities are available. You were thinking about, doing things outside. How do you communicate with people who are just clouded with other information and important, realities in their brain right now? So these are really good things to keep in mind as we continue this conversation. So thank you, Denise. All right. So certainly COVID-19 has upended our world, and it should upend our programs too. And I don't mean that in a negative way. Of course, it's obvious that all of our programs are upended, even if they were already socially distant to begin with. But the idea here, I think, is that, is there a way that we can think of our programming as a way of sort of walking alongside? That's why I have this picture of these two penguins, which I think was really great for this. That you're walking alongside the people that your nonprofit serves through this challenge. And that ultimately, what our goal is to try and put ourselves in their shoes, try and understand what they're missing, because they miss it too. They missed that event that they wanted to host, or that they wanted to, to have at the Garden Club. They're missing that after school program that they can't go to anymore. Students want to be in school. People want to be out and doing things, and they're feeling isolated and disconnected. And so what are the ways in which your nonprofit can help solve that problem for them, to help be that person that accompanies them through that sense of social isolation, or in many cases, the economic need that they may have as a result of this change? So I think that a good place to begin when you're thinking about a program redesign is to first spend some time finding out how COVID-19 is affecting those you serve. Whether you want to call it a formal needs assessment, or whether you want to do just something super rapid fire of getting a group of people together to talk, this is, I think, a critical step before you go through that redesign process of really getting that information back. And that's going to look different for everybody. For somebody whose nonprofit is doing events and putting things on, you really are kind of like working within a sort of customer relationship. It's about getting to know that customer and what their needs and wants and desires are and what they want to make happen. If it's a service to a population that might already have been experiencing some type of marginalization, it's really understanding how that's been amplified over the past couple of weeks and months, and what your program can do to help alleviate some of that pain. So I want to spend a little time talking about what those would look like. And so I've got 7 examples here, and I'm going to walk through some of them that you can use to sort of just share some ideas, and hopefully they can spur some inspiration or some ideas in your mind about what things might look best for your organization. So first, of course, there's always the survey. You can always do the survey. You can get on Google Forms or SurveyMonkey or any of those free ones to just put together something really short that says, hey, what is it that you're looking for? One thing that I would recommend as a way of doing this is that the surveys are really great because they're fast and easy. You can get it done today and send it out as soon as you have somebody else proofread it, to get it out to your email list or your social media or whatever. There's a temptation, I think, because there's so many different radio buttons and clicks and buttons that you can do, to have a lot of close-ended questions. But I think for this type of thing, it's worthwhile to have some of those more open-ended questions where people can talk to you and share with you what they're really thinking, to get a little bit more information about what that experience is like for the person you're serving. Another thing that I think is really important is social media. Now, social media is in its own weird space now, because people either have tons of time or on it, or they have kids and family obligations and are never on it anymore. And so you have this really weird social media patterns, I think, shifting in this dynamic. But there are a lot of Facebook groups or other types of communities online where you can go and listen to what other people are doing. There are a lot of nonprofit groups that are dedicated specifically to people who are in situations like yours, and who are saying, hey, our gala got canceled. What are you guys doing? When are you planning? We're trying for October. Is that going to work or not? So those are good places, I think, too, to find out some of that information. I think also that there's also an opportunity for program directors to really start looking at the new research that's coming out on this. There is a ton of people who are doing like in the moment research on COVID-19. And it started out at first where I felt like every organization you went to, or every website or every posting had some type of graph on the number of cases in your area. And that's an important thing to be following and keeping up on. You know, if, say, for example, you're working in a food pantry and you really want to understand, at least locally, where it's affecting people the most, having some really good data on employment in your community, having really good data on health access in your community can be really informative about where you start making those decisions, where you want to invest and spend the energy of your programs next. Focus groups, I think, is also a really great one. And, you know, it's funny because, you know, I think a year ago, if you had asked people, hey, can you do X, Y, or Z thing over Zoom? The answer would have been, no, that'll never work. And now we're all forced to. And so it's almost like, you know, the ability to sign up for a Zoom link or to do something online has all of a sudden become very, you know, much easier than it used to be before. An example of this, I do medical surgeries in my program director work, and we had to do some conversations with our medical team about what our programs were going to look like, and we were able to do a lot of that over Zoom, which was really great. And so I think that, and I never would have thought that would have been possible before. So, you know, we're starting to push the envelope on what's available with respect to technology, and I think that, you know, depending on what your cause area is and what restrictions you may have, you know, doing these types of focus group and having these conversations can be really great. You know, there's been a lot of these straight up telephone kind of conversations that I think have emerged recently. I think a lot of it has been too with like public officials as well who have done these types of things. But if you have access to a technology that would allow you to do that, that can sometimes be really easy to get a lot of people on and having a conversation in a way that's really accessible to a lot of people. I think that probably after, maybe in the period of like the last 2 weeks of March and the first 2 weeks of April, I got an email from every organization that I have ever done anything with. Like, it was like, I'm getting an email from my barbers. I'm getting emails from like something that I bought online 3 years ago. And all of a sudden they're like, this is how we're gonna approach COVID. And it's like, okay, look, I don't know if I need to know all this information. So there's, for a moment, there was probably some email overwhelm that everybody probably experienced. But I think now is a time to think about how you can be really targeted and personal in your email. So say, you know, you're an organization and maybe you're an after school program and you ran an after school program for 25 kids. You know, if you wrote a personal email to, especially if you know some of the parents really well and you feel like if you wrote them a personal email, they'd write you back. That now is a really good time to start doing that. And so saying, hey, what would you really want? Like, how would this really work? If we were to do X, Y, or Z thing, would this make sense? Or do you have an idea that we haven't even thought of yet? So that's really a great, I think, opportunity to just continue to stay engaged as much as you can. And if you feel like the big email blast is too impersonal and too get lost in the noise, then thinking about being specific and going with a smaller number of group of people who you think can give you some really good feedback. And lastly, talking to other nonprofits. I think that hopefully that you had a chance to do that in this session as well, to get ideas and have a little bit of chance to see how other people are doing things. But really, you know, we're all experiencing this challenge and it's affecting all of us in different ways. And it's not everything is going to be the same for each organization. But the ideas for your solution are oftentimes in the people doing similar work, and they're probably on this phone call. So it's spending that time to reach out to people and to make those connections can be really important. So with that, oh yeah, I have one tip I wanted to mention here too. Think about, I mean, we're really sort of focused in the now and the present. It's kind of hard to even think about 6 months from now. But sometimes it can be helpful, I think, to talk about a desired future with people. So like what they would like to see happen in the future. Recognizing the constraints we're in. What would be an ideal outcome given that we're still socially distancing? And that can sometimes be helpful for people to frame how they would respond to you.
And Drew, I have a question around the talking to other nonprofits piece, especially for an organization like us at the Nonprofit Center, and I think just our sector overall that is so collaborative. What are kind of some avenues or ways that you see folks connecting informally in the nonprofit sector that maybe we could integrate here that could help us continue to have kind of those informal conversations that help to build collaboration?
Yeah, I mean, I certainly think that there's a lot on social media that can be done to have those types of conversations. And one platform that I use a lot actually is LinkedIn, which I've never used to think was a really collaborative platform necessarily. because I think a lot of people can use some of the other ones a little bit more. But what's great about it is that you can actually search and find other people who have your exact program, like program director title. And if there's somebody in your area or in another city who does a lot of really similar work, sometimes just connecting with them and just saying, hey, I think we have a lot in common. I'd love to set up a 15 or 20-minute phone call just to connect and see, how we can share ideas. I think that's to me, I think that direct sort of interaction with other people can be really helpful. Sometimes it's a little intimidating to reach out to somebody, but I think after you do one or two, you'll find that it isn't too bad. And if you get one, sometimes it's like, oh, hey, look, somebody found me and they actually do a lot of similar work that I do. And that's kind of a cool thing. So I also think that there's both active conversations like that where you're really engaging with somebody, but also passive ones. So obviously I'm a huge believer in podcasts because I run one, but there are tons of people who are having conversations like this, and you can just put on a podcast while you're doing dishes or going for a walk, and you can hear about what a bunch of other nonprofits are doing about, approaching these problems. And there's tons of nonprofit podcasts out there that you can draw from. So I really recommend some of those other both active and passive means to be getting some ideas about it. Good question. And if either you do have questions, add them in the chat or just interrupt me is totally fine. Okay, so what I'd like you to do real quick, as you're thinking about your next steps, on the 9th page of your document, you'll see it's kind of towards the end there. I just have a little place where you can take notes as you're going along. So I've given you 7 ideas, and I'd like you to pick 3 of them. And in the next minute, write them down super quick. Which are 3 ways that you're going to reach out to find out more information about the people you serve and how COVID-19 is affecting them, and what desires they may have, what challenges that they're experiencing. So take 1 minute. I'm going to pause. We'll have a moment of nice peace, and you can try that out. All right. Maybe you only had a chance to do one, but that's okay. So since we're short on time, I want to make sure we keep moving here. One thing that you can do to try to help hold yourself accountable is on that last column there where it says timeline or when. Give yourself a goal to reach. So say hey, I'm a program director in Jacksonville and I want to reach out to 2 other people in the next 2 weeks and, see if we can set up a virtual coffee date or a phone call or something like that. People who I think are doing similar work that I'm doing, who we can mutually learn from. Something like that I think can go a lot of way to help you take that next step as you're thinking about these questions. So the next piece here that we want to talk about is, okay, so let's say you've done this, right? You've gone out and you've collected all this information that you now have in front of you. You've done some type of formal and informal needs assessment. And you've got this problem figured out. So now it's time to start moving into that planning phase. What are you going to be doing? And the first thing I think that we want to think about is revisiting goals of what you had before. Now, as a program director, you probably had something written out before. You may have had something as formal as a logic model or a theory of change, or maybe you just had something in the back of your head that you just used and you're just, you know what you wanted to achieve and it was already there. But taking that time to revisit those goals and see how they have modified or changed as a result of what's happened this year. So I'll give you an example of what I'm doing right now. In my role as program director at Child Spring, last year we did almost 700 surgeries around the world. And of those 700 surgeries, we had a dozen kids come to the US, which is a lot. Those cases are pretty intense because you have to do all the visas and host families and that whole stuff. Well, I already know that the goal that I set for myself this year of having another 12 kids come to the US is gone because they can't come, at least not maybe in the fall, we'll see, but certainly not in the near future. So that one's already changing in terms of the numbers and whatnot. but also it's an opportunity for us to start thinking about what are some new opportunities that could be underlying. So I reached out to some of the different partners to see which ones of our hospitals around the world were involved in COVID-19 in some capacity, whether it's providing direct care or whether it's doing relief in some other capacity. We reached out to figure out which ones were still going and which ones were not. And we were able to get a much clearer picture about what types of surgeries we're going to be able to continue to do around the world because we asked those questions. And we were able to then kind of revisit and rewrite those goals. So as you're doing this process, I'd like to challenge you to do one thing, which is to, I mean, you'll probably have gone to a dozen of these things where they would say, write SMART goals, which is true. You should have them be timely and you know, specific and all of that. But the thing that I'm going to add to that conversation to you today is to try and write the goal from the perspective of your client. And I'm using that term client as a general term. It could be your student, your member, your participant, your whatever that person is for you, who you serve. I'm just going to use that term client today because it's a bit general. But writing it from the perspective of that person is really important. So what does that mean? So you'll see there in step 2, there's an example of how you can do that. And in the worksheet down there, it has a little part in italics there where it says, be sure to start with the phrase, after completing this program, our clients will be able to do what? And by changing it from saying, you know, we are going to provide X number of tons of food to our community in the next year, or we are going to deliver 15 virtual events in the next year. By changing it and focusing on saying your clients are going to be able to access nutrition and food and their homes where they're going to be, or they're going to be able to, you know, have an enriching cultural experience because of these online events that you put on. What you've done is you've put that focus on what they're going to be able to do differently, which then really helps you understand from a design perspective about what you need to do to help that experience really happen for that person, but also how you're going to measure it down the line when you're thinking about data and evaluation. So you're able to really say, okay, not only do I know what I'm going to do, but I know what they're going to be able to do, and then what that change process is going to look for them. So let's see here, how are we doing on time? Yeah, we have time. We'll take about 30 seconds this time. And just back of the napkin, recognizing you haven't necessarily had a chance to go out and survey a bunch of people or do focus groups or call people to find out what's going on. If you were to write your goal differently today, based on what you know now, write one of them in your little document right here. Answering, or as it completes the phrase, after completing, you know, my program or whatever it is that I would name that, our clients will be able to do X.
And Drew, while folks are thinking through that, I just wanted to mention that if folks have a question they want to ask privately to either Drew or myself through Zoom, you can actually do that under your chat function. I know some questions may be hard to ask publicly, so just wanted to let folks know that that's an option.
Okay, so you've had a chance to think about that goal. My challenge for you is to think about what your second or third goal might be, or going actually back and dusting off that logic model you may have, or whatever kind of program documentation you have around what you want to achieve or what you want your clients to be able to achieve, and to revisit those and to think about how they're going to change based on what you learned before. I want to pause on actually not sharing the goal just because I know we have a little bit of time and I want to save some time for questions towards the end. So the next question then is to focus also on measuring your progress towards these goals. Now, for some of you, you may have gone through this process already. You've really thought about it, and maybe you're just tweaking it a little bit, and so you don't have to change too much. But for some of you, you might be thinking about how you're going to launch something completely different, and that this is really an important time to start thinking a little bit about not only setting those goals and identifying them, what they're going to be, what your client's going to be able to do, but then being able to then answer the question, what evidence are you going to accept that suggests that your client actually achieved what you wanted them to? So for example, if I were to use a really basic example and talk about this exact webinar workshop right now, I had written a goal for this that said, by the end of this presentation, of all the people who are here today, they're going to be able to identify at least 3 things that they can go do to collect more information or get more, data or information about the challenge faced by the people they serve. And I gave you 7 of them, and my hope is that you remember 3, or at least you have a document you can refer to, right? So if I were to evaluate that and I were to send an email out to all of you afterward and say, hey, can you tell me 3 of them, what you've done? Then I would know, right? That would be evidence that I could accept that we've reached those goals. So that's just an example that you can use to kind of guide your thinking. But you're thinking about this across all the different types of programs and all the different types of things that are germane to your area. So take that time now, though, to be thinking about what that's going to look like. I think a lot of times we get caught up in the day-to-day and the now of just being able to figure out what you're going to do next week if you're trying to launch something online that you've never launched before and trying to work that out. But we're asking some of that questions up front. Okay, how will I be able to know that this worked the way I wanted it to? And that the people who came, seeking something out of my nonprofit, that they got what they wanted and that they came for. So thinking about that question. So you can also do that same process right here. I won't spend too much time on it today because I know it'll take some deep thinking to really think about what it would look like to get that information and how you might collect that and when and who. But this is more of just a guide here that you can use after this presentation to start thinking about that. After you've written that goal in the first section, and you've got the 3 goals lined out or however many you decide, thinking about how you're going to collect your impact towards each one of those types of things. And this is a chance where I think you can be also really creative. Certainly, like many of you, are in a specific field area and there's certain outcomes that are just like always there. So if you do any work with youth and with schools, you're probably thinking about, is this after school program or this really youth cultural enrichment program going to help students do better in school? You could measure that through attendance or through grade point averages, things like that, or standardized tests, and have conversations with school districts to try and figure out how to measure that. But it may also be an opportunity to be creative and say, what are the things that we're also working on that maybe aren't those sort of typical indicators, but that we could also be creative and find new ways to measure and have that conversation. Because I think this is, again, as I said before, an opportunity to sort of peel back the assumptions that we've been making about our programs for the past 10 or more years about how they operate and function, and saying that, maybe we could try something a little different. And I think that a lot of people right now are giving you nonprofits and really everyone a lot of benefit of the doubt in trying something new. And so maybe now is the time to try that crazy idea that you've always had. Then lastly, I've got a section there for step 4 about what these programs will offer. And program design is its own whole piece too, where you're going to spend time about really thinking about all the logistics around who's going to get access and how and what and how many staff are you going to need, and do you need buildings or not, and who's going to get access to technology, all that logistical stuff, right, which is just hard. So here's just a place where you can kind of jot down some ideas or things that are burning questions for you that you want to kind of get tackled and figured out first. But what I will say about all of that is that sometimes, and I am guilty of this as a program director, we get ourselves so caught up in the logistics and the details that we often tell ourselves what is not possible before we tell ourselves what is. So we say, oh, I can't do that, I don't have the staff. Well, what if you did have the staff? Oh, we can't do that, we don't have the budget right now. Well, what if you did have the budget? Oh, we can't really accomplish that right now because of social distancing. And that's really relies on in-person contact. Well, what are creative ways that we can think about still maintaining that connection through social distancing? It's hard to do that. I think there's a tendency, especially during times of crisis, to just be like, okay, look, I'm just going to achieve what I can achieve and get through the end of the day because I just don't have the energy for much more than that right now. And I think for most of March and probably most of April, I felt similarly. And I was just about surviving and making sure that I had like an inbox that was more or less clean, and that kids were more or less getting served around the world, because that's about all we could achieve. But now, like I'm kind of going into the summer, I'm starting to ask some of those deeper questions about like, hey, what if we actually did try to tackle some of these ones that I didn't think we could tackle before? And so this might be an opportunity to start thinking about that too. All right. And I'm going to pause and I'm going to open it up for questions, because we've got a good 10 minutes here. I think we have some chances to kind of talk through some of those things. And I also want to turn it over to Isis, who I think wants something to share too before we do.
Yes. So I wanted to take a few minutes while folks are kind of digesting all the information they just got and maybe thinking about some questions they want to ask. I am putting our survey onto the chat. I would love it if everyone could just take a minute right now to open it up and make sure that it's at least open on your computer. We would love to get 100% of the folks that were on this call today to at least take the survey. Your feedback is huge for us to get to know what kind of programming you want and know how you're reacting to the information we're getting to you. As Drew just mentioned, surveys are huge. One of the only ways that we can really connect with everybody. I wish that I could have the informal conversations to know how each and every one of you are doing. So if everyone could just take a quick minute to do that. And then as you have questions, if you want to put them into the chat, I'm happy to ask them for you. And Drew, I don't know if you're comfortable with folks just kind of coming off mute and asking them.
Oh yeah, not a problem at all. Go ahead and come off mute and you can ask me any question, and I'm from any part of the presentation, I'm happy to help try and help out.
And now this is the time to ask if you have any really specific questions about your programming or any unique challenges that you've been having that maybe we didn't cover during the presentation.
Oh, good question. What are some ways we can ease fears when reopening? So actually a person who I had a great conversation with recently is Brad Furco. He's a health communications specialist. He's actually on the first episode of our podcast, and he talks about the process and the framework that nonprofits can use in crisis communication. And it's a great listen. And it's like short. It's like his interview is like 10 minutes long, but I felt like I walked away with that with so much knowledge, because he shared really what are the, not so much necessarily the exact specific things you can do. I mean, we can go to the CDC websites to, they just released their report this week around what guidance could look like for schools and other organizations with respect to making sure that you have a healthy workplace and you have a healthy, place of operations. But that there's a real kind of process around communicating during a crisis and strategies that you can use that can help the people you serve feel safe, feel informed, feel like you're an organization that has it under control and understood, and that when they interact with you and whatever that looks like, that they feel comfortable to do so. And so I'd recommend taking a listen to that, because I think he gave some really great advice on how to ease some of those fears. I think a second part of it too is to continue to keep doors open for communication and to keep it two ways. Because, so if you send something out that says, we're going to do X, Y, and Z thing, getting that feedback and listening and taking it seriously when you have some people say like, I don't know if that's going to work, and modifying and adjusting things as much as you can. Sometimes I think we just have to get something out there, and we have to, have it, and it's going to be clear, and everyone's going to just vibe in. A lot of people are going to wrestle with whatever you send out, because everybody feels, I would not say that everybody feels similarly about this pandemic and how they're going to interact with it themselves. And so you're probably going to get a little pushback on some things. And so understanding where that's coming from, the reasons for it, and trying to adapt and accommodate where you can, I think is helpful. So another question here, what kinds of questions would you include in a survey? Perceived value specific programs, other programs you'd like to see in comfort level. So these are great questions here to ask. I would say that the question that, first off, is to keep questions open-ended as much as you can. And in doing that, asking them about I think it's a time you can ask the specific things, and you should, like, what if we did things X, Y, or Z way, or here's, a list of new formats that we could use to, deliver our program or service. or to host an event or something like that. And, getting that information would be good. But you can also, I think, get back to some core fundamental feelings and reasons for why people have interacted with your nonprofit in the first place. Why does this matter so much to you to do this? And if I understand really why you go out of your way, you volunteer your time, you go out and do things for our organization, you volunteer and spend time with the children that we serve. You are a child who is served, and you come here every day, even though you don't have to. Why? And really having a clear understanding of what that is, I think, can also be as illuminating as some of the more concrete and logistical questions around how you're actually delivering that program. Because it may be that you find that something new is uncovered. I mean, I am rediscovering myself how much I missed interaction with people, and how much I missed certain things about my life that I might not have thought about even 2 months ago. And so the people you serve now are going to answer the question, why do you care and why are you engaged with our nonprofit, in a way that's very different than maybe they would have 2 months ago, because now they can't, or at least maybe they can't in the way that they did before. So I think asking some of those core questions would be important too. Other thoughts or questions?
I did see, going back to kind of some of the intros while folks are asking questions, a lot of focus on obviously just the virtual aspect of all of this. And I think what we've been hearing is this kind of anxiety of investing so much into creating an infrastructure for programming virtually, and having to go back to normal, whatever that is. So I don't know if you can just kind of speak to that anxiety a little bit.
Yeah. I think, years ago, before I got into some of this nonprofit work, I actually worked at a university doing online education. And my role was to help faculty members who had always lectured and had always kind of presented in person to their students. What would your class look like if you did it online? And I think that there was always a certain sense of anxiety about how a particular aspect of their teaching that they really loved was going to get lost in that communication. And in a sense, that sometimes that anxiety was there, and there was not something that I could necessarily do to alleviate that. But going through the steps of that process and focusing on the core things, going back to that question, what do you really want students to learn when you give this amazing lecture? What do you want students to be able to do when you ask them to do this particular assignment? Having those kind of core level conversations then sort of eased the tensions a little bit and opened up opportunities and possibilities for something totally different. And many of the faculty that I worked with taught the courses in very different ways. And when they went to teaching online, they're just different modes, right? So but I guess it's not necessarily totally answering your question, but what I would say is if you're going to make the jump to start to do something fully virtual, fully online, over Zoom or whatever, taking the time to recognize that it's going to be a different program. And you may even change the goals and outcomes that you really want out of that program. Or you may change the nature of the actual activities or services or programs or whatever it was that you did, are also kind of thrown out and you try something totally different. So the moving online is going to be hard, because you're thinking about making those decisions around technology and investment and budget and the rest. But it is an opportunity for you to come back to those core things about what you really want to achieve. And so doing some of this redesign work while you're thinking about it, I think is equally or more important than what you actually choose to do with your technology.
I kind of feel like I just had an aha moment of viewing this through the lens of, instead of trying to turn a program virtual, because sometimes you just can't, going back to, like you're saying, to those core questions of what are you trying to accomplish? Because I think a lot of times, and Danny, I totally feel your frustration around trying to transfer an event that you've done in person virtually. It's kind of restructuring how you view it, as opposed to trying to change this thing that maybe can't be this other thing, instead of focusing on what the core goals are. So I love that.
Yeah, I mean, a good example, like I used to tell faculty members who would go up and say, you know, I give a 50-minute lecture, and I'm dynamic, and I walk and I move, and how am I going to do that? How am I going to get a video camera to follow me on stage as I'm giving my lecture, right? And then I would come back to them and I'd say, you know, the research says that when you give a lecture, that most students turn off after about 8 minutes. And they're like, what? How am I going to deliver a lecture in 8 minutes? I mean, somehow you guys are all here 60 minutes through this, so I guess maybe some people can stick it through, right? Turn off after 8 minutes. But that's just like mind-blowing to them. And they're like, what do you mean I can't give my lecture? And then it's like, okay, how instead can you teach your students to achieve the outcome without a lecture? And then all of a sudden the new opportunities kind of come up. So if you're starting this conversation off, don't focus on the program or the software that you're going to need. And instead, I would say focus on what you want to achieve and what are the most lo-fi ways that you can do it. Early on in online education, people taught it by just mailing things to each other. In like the post office, they would just take a book and some resources and mail to somebody, and then they'd mail the things back. It was really, really low tech, right? When I work with faculty members, I always tell them, like, look, start with just the basics. Like, you know, don't do the fanciest thing with, you know, amazing breakout rooms and people like ISIS who can just like make this whole amazing stuff work, right? Start with the most simple thing that you know everybody knows how to use. So for some people, it's like, okay, look, I'm gonna do a Facebook Live because I know that all I have is a phone and I have Facebook and that's all it takes, and I'm just gonna do that. And that can sometimes be a great place to start, and you know, thinking about the most simple solution that you can have. Or maybe if you're thinking about it from a design perspective, like a minimum viable product that you can get out there to test and see if, okay, did this work? Did I feel comfortable doing this? And, you know, could I take the next level to something more complicated?
I'm seeing Denise, thank you so much for sharing that information, but be careful, I might tap you to share that information more widely.
Well, as we're coming to a close here, what I'll just leave here is my email, drew@commongoodData.com. And if you have any questions about any of this kind of stuff, I'm happy to just sit down for a quick phone call. It's not a problem at all. And whatever I can do to be of use to you as you're thinking about these questions, going through this redesign process, I'm happy to be here and to help answer some of those questions. And I know that I too am also thinking about them as well. So I'll probably come back and ask you some questions myself as I'm thinking about that from a program director lens as well. But I think ultimately what's important is to keep having those conversations and keep talking to people and seeing what they're doing, and recognizing that you are not alone in this struggle, that there are many other people who are exactly in your role, and they may be working in a different cause area. They might have events instead of programs or services or whatever. But that we can all learn from each other. And so I want to just say thank you so much for your time, and for the Nonprofit Center of Northeast Florida for providing this platform and opportunity to have this conversation. I'm so grateful and look forward to staying in touch.
Thank you so much, Drew. And again, I just want to make another quick plug for the survey. I only have about 3 responses in right now. I will contact all of you after this to get your responses if I don't get them. And then I did just want to plug a little bit. Next week on Thursday the 28th, we're having another free open workshop around powerful partnerships. That's going to be, I think, 9 to 10:30 on Thursday. You can find that information on our website, and that's going to be looking a little bit at how kind of looking again at redesigning and rethinking. How do you look at the partnerships and relationships and connections you have in your life and as an organization, and maybe start rethinking how you leverage them to meet a need that you can't meet right now. So with that being said, thank you everyone. Thank you, Drew, and have a great rest of your week and a great weekend.
Thanks everyone.
Thank you guys.